Hi everybody, I'm Ming, and with me I have Jedrick, Jasper, Lucas and Xiang with me, and this is our medical imaging presentation. So to start off with our introduction, today I'll be presenting on computed tomography or CT imaging, one of the most commonly used diagnostic imaging techniques in medicine. CT uses a rotating X-ray beam to produce multiple thin cross-sectional images, known as slices. And unlike conventional X-rays, CT provides detailed anatomical information. And by stacking these slices, the system reconstructs three-dimensional images, allowing accurate detection of conditions such as fractures, tumors, internal bleeding, and organ damage. So, coming to the physical principles of CT imaging, CT imaging is based on the production, interaction, and detection of X-rays. Inside the X-ray tube, electrons are emitted from a heated cathode and are accelerated towards a tungsten anode producing X-rays. And two types of radiation are generated: Bremsstrahlung radiation, which produces a continuous energy spectrum, and characteristic radiation, which produces discrete energies unique to tungsten. And during scanning, the X-ray tube and detectors rotate around the patient, collecting projections from multiple angles. These data represent X-ray attenuation through tissues and are reconstructed into cross-sectional images. So now, X-ray attenuation follows the Beer-Lambert law and depends on tissue thickness and composition. In diagnostic CT, interactions are dominated by the photoelectric effect in bone and Compton scattering in soft tissues, where X-ray energy ranges from 30 to 150 keV. And these differences are quantified using Counts-Field units, ensuring consistent image contrast. So now, lastly, for the CT instrument design, the X-ray tube uses tungsten and rotating anode with oil cooling to handle high heat, enabling fast, high-power scans. Collimators shape the beam to reduce unnecessary exposure, while anti-scatter grids improve the image contrast. And solid-state detectors convert X-rays into electric signals, and multi-detector arrays acquire multiple slices simultaneously, reducing motion blur and scan time. The gantry rotates continuously using slip ring technology. In helical CT, table movement and pitch control scan speed, image quality, and radiation dose. Images are reconstructed using filter back projections or iterative reconstructions and stored in DICOM format for PACS viewing. So now let me move on to Lucas.
Thank you, Xiao. Moving on to data acquisition, this is the stage where CT scanner collects X-ray data as the tube rotates around the patient. Different tissues absorb X-ray differently, and detectors measure this attenuation from many angles. This information forms projection data, which is later used to reconstruct CT images. Moving on to the different scanning types, there are two main CT scanning types, sequential and helical. In the sequential scanning, the patient table stays still while one slice is captured per rotation. This gives accurate slice positioning but is slower and more prone to motion artifacts. In helical scanning, the table moves continuously as the gantry rotates, creating a spiral data path. This allows faster scans and reduces motion artifacts, making it ideal for trauma and whole body imaging. However, very high pitch values can increase image artifacts if not properly optimized. Modern CT scanners use multi-detector CT or MDCT. Multiple detector rows capture several slices in a single rotation, reducing scan time and improving spatial resolution. This allows thinner slices and makes MDCT especially useful for emergency imaging, CT angiography, and cardiac scans. Image quality and radiation dose are affected by scan parameters. KVP controls X-ray energy, MA controls photon quantity, pitch affects speed and dose, and slice thickness influences detail and noise. These must be carefully balanced to ensure good image quality while keeping patients safe. To reduce radiation exposure, dose optimization techniques are used. These include lowering KVP when appropriate, automatic tube current modulation, and selecting an optimal pitch. Efficient acquisition reduces scan time, lowers dosage, and maintains diagnostic image quality. Next, I'll move on to image reconstruction techniques in CT. After data acquisition, images must be reconstructed. Filtered back projection, or FBP, is a traditional method. It uses mathematical filtering to reduce blurring before forming the image. FBP is fast and cost-effective, but image quality drops at low doses due to increased noise. More advanced systems use iterative reconstruction methods. This method repeatedly refines an estimated image by comparing it with the actual scan data. It reduces noise, improves image quality, and allows lower radiation doses, making it ideal for low-dose CT imaging. I'll now pass the time to Xiang.
Thank you, Lucas. Okay. Iterative reconstruction is widely used in low-dose CT because it significantly reduces radiation exposure while maintaining good image quality. By lowering image noise and preserving important anatomical details, it allows reliable diagnosis even at reduced scan doses, especially for patients who require repeated imaging. CT image quality is affected by noise, spatial resolution, contrast resolution, and artifacts. Common artifacts include beam hardening, motion blur, streaks, and partial volume effects. These can reduce image clarity and complicate diagnosis if not properly managed. CT is widely used due to its high anatomical detail. Key applications include trauma assessment, oncology, pulmonary diseases, abdominal and pelvic imaging, musculoskeletal evaluation, and neurological imaging. Its speed and accuracy make it essential for many clinical settings. In emergency care, CT provides rapid imaging, high spatial resolution, and full body coverage, which is critical in trauma cases. However, it also has its limitations, such as exposure to ionizing radiation, possible contrast-related risks, and image artifacts from motion or metal. These factors must be considered during clinical decision-making. In oncology, CT is used for cancer detection, staging, and treatment planning. It helps guide surgery and radiotherapy while protecting healthy tissue. CT is also used in follow-up imaging to monitor treatment response to detect recurrence early. CT supports clinical workflow by providing detailed cross-sectional and 3D images. Using Hausenfield units, doctors can differentiate tissue density such as vascular versus non-vascular lesions or different types of hemorrhage. This information improves diagnostic accuracy and treatment planning. After scanning, radiologists review the images and produce a report outlining key findings and possible diagnoses. These reports help clinicians assess disease severity, prioritize treatments, and determine the next steps in patient care, leading to better patient outcomes. Now I will pass the time over to Jedrick.
Thank you, Xiang. I will now be moving on to standards and regulations. First, DICOM standards ensure CT images and related data are stored and shared consistently. A key component is the patient module, which identifies the patient using attributes such as patient ID and responsible person, ensuring accurate patient identification. The general acquisition module records how the scan was performed, including the acquisition UID and scan duration. The CT image module contains technical details of the images, such as image type and scanning parameters like kVp, which represents the X-ray energy used. The SOP Common module supports correct identification of and storage of CT images, ensuring proper system operation. These are some examples of the modules for DICOM standards in CT imaging. Next, HL7 and PACS integration enables smooth data flow between clinical systems. The process starts when a patient is registered in the HIS, RIS, or EHR and a CT scan is ordered. This order is sent as an HL7 ORM message to PACS. The CT scanner retrieves exam details from the DICOM modality worklist, reducing manual entry errors. After image acquisition, CT images are transmitted to PACS using DICOM. Radiologists review the images in PACS and generate reports, which are sent back to EHR via HL7 ORU messages. Together, HL7 and DICOM ensure accurate linking of patient data, images, and reports. Finally, radiation safety and quality standards protect patients and staff. The ALARA principle requires radiation doses to be kept as low as reasonably achievable. International organizations such as the ICRP and IAEA provide guidance on dose optimization and justification of CT scans. Standards like IEC 60601-2-44, IC 61223-3-5, and AAPM guidelines ensure CT scanners maintain safe operation and consistent image quality. Those indicators, such as CTDI vol and DLP, are used to measure patient exposure. In summary, DICOM, HL7, and radiation standards work together to ensure CT imaging is safe, accurate, and efficiently integrated into clinical practice. Thank you. I will now be passing the time over to Jasper.
Thank you very much, Jedrick. So, medical imaging data contains highly sensitive patient information, including personal details and internal body images. Protecting this data is essential to maintain patient privacy, comply with healthcare regulations such as the Health Insurance Portability and Accountability Act, and ensure safe and accurate clinical care. So, in any case that imaging data is assessed, altered, or lost without authorization, it may lead to the misdiagnosis, incorrect treatment, and serious legal, financial, and reputational consequences for healthcare providers. These risks are significant for CT imaging as it relies heavily on digital storage and frequent data sharing between CT scanners, PACS servers, radiologists, and clinicians. To reduce this risk, healthcare providers rely on secure storage and data sharing systems with strong built-in security features. Encryption protects imaging data by ensuring that intercepted information cannot be read without proper authorization. Access controls such as strong password and multi-factor authentication limit system access to authorized personnel only. And in addition, network security measures including firewalls, intrusion detection systems, and regular software updates help protect imaging systems from cyber attack, system failures, and accidental data loss. Beyond technical safeguards, continuous monitoring also plays an important role in maintaining data security. Monitoring system and audit logs help to detect unauthorized access or unusual activity early and ensure accountability by recording who accessed or modified imaging data. So, in any event of a security breach, a clear incident report plan also allows healthcare providers to contain the issue quickly, restore affected systems, and notify patients and regulatory authorities as required. In conclusion, protecting medical imaging data is crucial for preserving patient privacy, maintaining trust, and supporting accurate clinical decision making. So, by combining strong security measures with continuous monitoring and effective incident report planning, healthcare providers can safeguard CT imaging data throughout its life cycle while delivering safe and reliable patient care. So, in summary, CT imaging is a very vital tool in modern healthcare, providing fast, high resolution images that support accurate diagnosis and treatment. And advances in CT technology have made scans quicker, more precise, and safer. Because CT images are critical for clinical design, critical decision making, ensuring that accuracy, security, and availability is essential for safe and reliable patient care. So, these are some of our references, and thank you very much.